When I first decided to become a herbalist, I did out of personal interest because I used to give advice to everyone without qualifications. And I remember my grandfather, once he retired from his job in an office, tending a vegetable patch and using a manual about Rudolf Steiner's biodynamic growing of plants and herbs, and suggesting that I should actually find out more about it, and it influenced the whole family. I have an uncle who now lives on the shores of near Genoa with olive trees. My mother lives in the mountains and has beehives. And although we are all different in the family, only one thing in common in my family is the love of nature. And I've taken it a little bit a step further, and really seriously thought about health, nutrition, and herbs instead of many common medicines that are sometimes overused. So I never ever really use an aspirin or antibiotic, only in case of surgery when really the doctors require it. I'm blessed with good health, so I don't suggest that other people should never use medications. And I always suggest that people take herbs in addition to the doctor's advice. But at the same time, sometimes this can reduce the need of medication. And over the years, I've seen a number of conditions, viral, so infections, digestive problems, stress problems, neurodegenerative disorders to do with aging. So I love the term anti-aging medicine. It's more posh than to say it's prevention of things like Alzheimer's disease, which is very common, and keeps you young and beautiful. And so I do see people for various things, really, for quite a multitude of conditions. And recently, I've also collaborated with the International Mycotherapy Institute, which is a really small institution in Europe, dealing mainly with cases of oncological patients, where doctors use medicinal mushroom capsules in addition to the ordinary therapies. Yeah. And so that's been an exciting experience, with a little bit more technical and specialized than my normal range of patients. So the scope of our work can be of support to many areas, mainly in gynecological areas, dealing with hormonal conditions for ladies and gentlemen alike, and also urinary tract infections, candida infections, which are about, a vague estimated 80% of fungal infections, and are very much underestimated. Because I also use a lot of medicinal mushrooms, I'm very well aware of these fungal infections and need to balance in the digestive system the amount of fungal infections and good mushrooms, good fungus, good mushrooms. So we don't only have good and bad bacteria in the gut, but also good and bad mushrooms, and that is underestimated. And so that has brought my practice also to a different level. And so I integrate herbal medicine with mushrooms therapy, which is, however, traditionally still being considered part of herbal medicine, even though mushrooms are, strictly speaking, a different kingdom, more similar to that of animals than to that of plants. And so I think these 10 years have been really exciting for me.